welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman. Today I'm going to talk about a Lancet study which shows that half of COVID survivors exhibit one symptom even 2 years after infection. More than half of people hospitalized with COVID-19 still have at least one symptom 2 years after they were first infected with the SARS-CoV-2 virus, according to the longest follow-up study published in the Lancet Respiratory Medicine journal. The research followed 1,192 participants in China infected with SARS-CoV-2 during the first phase of the pandemic in 2020. While physical and mental health generally improved over time, the study suggests that COVID-19 patients still tend to have poorer health and quality of life than the general population. This is especially the case for participants with long COVID who typically still have at least one symptom, including fatigue, shortness of breath, and sleep difficulties 2 years after initially falling ill, the researchers said. The researchers noted that there's a clear need to provide continued support to a significant proportion of people who have had COVID-19 and to understand how vaccines, emerging treatments, and variants affect long-term health outcomes. They evaluated the health of 1,192 participants with acute COVID-19 treated at Jin Yin Tan Hospital in Wuhan between January 7th and May 29th, 2020 at 6 months, 12 months, and 2 years. Assessments involved a 6-minute walking test, laboratory tests, and questionnaires on symptoms, mental health, health-related quality of life, if they had returned to work, and healthcare use after discharge, the researchers added. The median age of participants at discharge was 57 years and 54% were men. 6 months after initially falling ill, 68% of participants reported at least one long COVID symptom, according to the researchers. By 2 years after infection, reports of symptoms had fallen to 55%, they said. Fatigue or muscle weakness were the symptoms most often reported and fell from 52% at 6 months to 30% at 2 years, the researchers said. Regardless of the severity of their initial illness, 89% of participants had returned to their original work at 2 years, they said. The researchers noted that 2 years after initially falling ill, patients with COVID-19 are generally in poorer health than the general population, with 31% reporting fatigue or muscle weakness and 31% reporting sleep difficulties. COVID-19 patients were also more likely to report a number of other symptoms, including joint pain, palpitations, dizziness, and headaches, they said. Around half of the study participants had symptoms of long COVID at 2 years and reported lower quality of life than those without long COVID. In mental health questionnaires, 35% reported pain or discomfort and 19% reported anxiety or depression. Long COVID participants also more often reported problems with their mobility or activity than those without the disorder. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.